Hello, I'm Dr. Marla Shapiro, a past president of the Menopause Society. And today we're going to be talking about something really interesting, the rationale for population genetic testing. That means, can we do gene testing and risk scores that are going to guide the way that you as a woman are managed? And to have this discussion, I'm joined by Dr. Lisa Madlensky, who's the program director and genetic counselor, Family Cancer Genetics Program at Moores University of California, San Diego Cancer Center, a professor in the Department of Medicine, and the interim chief, Division of Genomics and Precision Medicine. So thank you so much for joining us today.
My pleasure. Happy to be here.
So women do want to know about the notion of, rather than doing, a mammogram or colorectal screening or whatever it is that we offer them in our routine preventions, is there a better way? Has genetic testing changed? And certainly I think the answer to that is yes, but how has it changed in recent years?
Yeah. So many women are familiar with the BRCA1 and BRCA2 genes, or sometimes they're called the BRCA genes. There have been a number of celebrities that have gone public with their own personal journey of testing for these genes. And the idea there is that there are some genes in the population that have been running through families that cause people to have a much, much higher than average risk of getting breast cancer or other cancers like ovarian cancer, for example. And we've been doing testing for these genes for a number of years, a couple of decades actually. But typically, the testing has only been available to people who already kind of know there's high risk in their families. This hasn't been something that's widely available to anyone who wants it. That's where things are changing a little bit. We're now studying the idea of, is it appropriate and does it make good medical sense to offer these tests to everyone? The other big change is that in addition to those BRCA genes, we now know that there are many, many other genes that also can impact someone's cancer risk. So people often don't know the names of these. They're just much less common, and there haven't been news stories about them. So, but things like the ATM gene or the PALB2 gene. So they all have a
Right.
letter number code to them, but they all kind of work in the same way in that if you have a mutation in one of those genes, it means that your cancer risk is higher than the average person. And that means that you may be someone who's appropriate to do things like early detection in a different way, more aggressive screening or surveillance, or risk reduction, which could mean medications, it could mean risk reducing surgeries. So there's a lot of different ways that this information can be used to help a woman really personalize her
Mhm.
medical care based on her level of risk.
So, as a woman in general, and I can speak about my own experience when I was diagnosed with breast cancer 2 decades ago, the targeted screening was for women like me. But the question is as an average woman, should I be getting genetic screening? Because you certainly see advertisements for this. You can do your genes, you can do your cancer risk. Is this something that I should be investing in without necessarily having, broad headlights that yell, hey, your family history is worrisome here?
Right, right. And it's a great question. There are a number of research studies that are looking at this question right now because there's a few challenges with it, right? So one is that we want to make sure that if the test is available, that it's equitably available to anybody, right? And a lot of health systems right now are not really set up to be equitable for all folks, unfortunately. We want to make sure that for the people who do test positive, on any of these medical tests, that they have access to now the higher risk care that is recommended for
Right.
those who test positive. I think it's also important to step back and remember these mutations, these genes in the population are relatively rare. And so, typically only about 1 or 2% of people are actually going to test positive once you get out into the general population.
Mhm.
So a lot of times, the news might make it seem like these are much more common than they
Right.
are. But about 98% of people who do this type of testing will be negative, and they will get that reassurance that they're not carrying one of those mutations.
So women in general are very familiar with the BRCA gene, as you mentioned earlier, but there's this notion of doing testing for your overall cancer score. So talk to me about the difference for most women out there who are looking at maybe screening for breast cancer versus the notion of what's my risk of developing any type of cancer? Is there a way to, score that, if you will?
Yeah, there isn't necessarily an overall cancer risk score as of yet. Where there's a lot of research right now is in the area of what's called polygenic risk scores. And these can be developed, and they are being developed for almost any type of cancer. So in breast cancer, that's always one of the big examples we talk about. This is sort of looking at tiny little genetic changes that are occurring throughout our whole genome. These little changes are not the same as a mutation in a BRCA gene, for example, that
Hmm.
gives you a big increase in your risk. These
Right.
are tiny little changes that can add up. And if you have enough of these little risk genes, it can mean that you're someone who's appropriate to be watched more carefully than the
Hmm.
average person, for example. But these are being developed for colon cancer, they're being developed for ovarian cancer. So the little genes that change this risk don't necessarily change your global cancer risk. They're
Hmm.
really cancer type specific. So
Right.
you can envision in the future, you might go in, give a little drop of blood or a saliva sample or a cheek swab or something. Your DNA gets fed into a computer program, and it might say, well, here's the average person's risk for each of these cancers. Your breast cancer risk is a little lower than average. Your colon cancer risk is a little bit higher than average. And maybe your ovarian cancer risk is a lot higher than average. So now
Right.
we're going to focus our discussion on that. So
Yeah.
it might drive the way you think about what are my health priorities in terms of things I'm at higher risk for or things I'm average risk or lower risk for.
Certainly the way of the future. So that brings us to, are there any studies in the general population? If I'm an average woman, I'm really interested in getting involved in this. Is there a way that I can get involved without necessarily asking for a test that I'm going to be told, no, you're not high risk, you don't need, to learn more about my personalized risk?
Yeah.
And maybe that then, as you say, will change what I, as an average woman, am told to do, whether it's frequency of mammograms or colorectal screening or whatever it may be.
Yeah, yeah. So one of the largest ones that's going on right now in the US is called the Wisdom Study. And the Wisdom Study is focused on the idea of doing a very personalized risk assessment for a woman's breast cancer risk. So
Mhm.
this risk assessment in the study for women who are between 30 and 74, and they're interested in this, they want to know what's my personal level of breast cancer risk specifically. It includes the genetic testing for the in the traditional way, so the BRCA
Right.
genes, and then also a bunch of other breast cancer genes, and genes for some other types of cancers as well. And then it includes that polygenic risk score we talked about, where you get a score and you're kind of like a little higher, lower, or a lot higher, or lower. We're testing out different ways of calculating those scores because that's still a kind of new technology, and there's a
Mhm.
variety of ways those scores can be calculated. So one of the goals of the study is figure out what's the best way to actually calculate that score. And then it includes the things you normally get asked when you go see your doctor for your checkup, like, have there been any changes in your family history over the last year? We ask people about if they've ever had a breast biopsy in the past. When you go for your routine mammogram, they'll tell you what your breast density is. So we include that in your score. So all of this gets put together, and we do a personalized assessment to try to figure out who are the women who really do have the highest level of breast cancer risk so that they can access high risk screening programs.
Mhm.
And then who are the women who, they now know, okay, for the next year or the next couple of years, they looked at every possible known risk factor and couldn't find any. So I
Right.
am average risk, or I might even be lower than average risk, and I can kind of follow the routine
Mhm.
recommendations. So the study is aiming to say, is that actually a better way of doing breast cancer early detection? Or is it kind of the standard old way where we tell everyone, just follow the guidelines, do your regular screening, and that's that. So it's going to be an interesting study to see how this shakes out.
Well, thank you so much for joining us. Certainly, we're going to stay tuned because women are interested in this and healthcare practitioners are interested in this, the notion of personalized medicine and mapping. So thank you so much for joining us today.
My pleasure. Thank you.